You may have noticed more people wearing masks in public spaces. This isn't unusual. With the uptick in reinfection cases, Dr. Sarani says taking that kind of precaution is a good thing.
Even as of yesterday, if you look at it, we had more than 100,000 people who had infection. And even in Nueces County, it's almost 175 people who were infected. Many of those were reinfection.
But the challenge with the numbers is that these can be an underestimation because people have the option of at-home testing.
I think people are recognizing that there is a higher incidence of infection, and a lot of the folks who have already received the vaccine or they have the infection with COVID in the past, they're getting reinfection again.
Dr. Sarani says the vaccine is doing its job, which is preventing serious illness and hospitalizations.
Now the question really come in is that are you getting reinfection is because the virus is smart and the variants are coming in, and the vaccine may not be completely protecting you against that.
The second possibility is that the vaccine immunity wanes off after a certain time. That may be the reason why we're seeing more reinfections. Boosters, along with vaccinations, are crucial.
I think we have to go beyond that. We have to have a constant state of vigilance. In other words, if you see increased number of cases in your community, then you need to make sure that you avoid large public gathering.
Social distancing and washing our hands are practices we've been doing for the past few years, but work hand in hand with vaccinations and boosters, including vaccinations that were recently approved for those 6 months and up.
If you look at the bigger state like California and New York, they have more than 200 cases of reinfection. So the reinfection is going to happen depending on your community prevalence or incidence of those disease. The higher number of the cases are in the community, the more chances you may get infection.
Simone Simpson, 3 News.